Good evening, my YouTube viewers. It's Palestine here. Thank you. Welcome to my channel, and thank you for watching my video. I've got lots of videos that I would like to make, and I had some free time, namely that my sick friend is working this week in the evenings, so I'm not seeing him in the evenings, so that frees me up to do some of the other things that I need to do, such as study my data science channel and make videos on my data science channel and this personal channel. And so I thought, well, I better go ahead and take advantage of the opportunity while it exists, because he demands a lot of my attention, but he is getting better. He's able to go sit on my bed and lay on my bed and play this game that he has, that he doesn't need to read to play that game, so he likes that game. And he's able to watch a video, so he's able to lay on my bed and take a nap. So he is able to do a few things by himself, but other than that, he really demands all of my attention. So since I'm not seeing him due to the fact that he has to work, I thought I better go ahead and get as many videos in as I possibly can. So what I wanted to talk about in this video is my dental appointment, because if you watch my last video tells you that I had a dental appointment today. So I had my dental appointment today. It's sort of like, it's in the town that I live in, but it's in the outskirts. So it really is sort of like in another town. It's in another borough council as well. But I take the bus to get there, because it's a really good dentist, and it's private. They don't take any NHS patients. So that means you have to pay for all of the work that you get. And so basically I pay something like £22 a month. So twice a year I can get my teeth checked and cleaned. And then the thing is that if I need any work, then I have to pay for that work on top of the cleaning and checking. And I'm supposed to get a discount. For that. So I don't have a lot of money. I don't have hardly any money, but I started going to that place when I worked at Foster Wheeler. And so because my teeth had been ruined by another dentist, and because my teeth had been ruined by another dentist, I started going to this dentist. And my dentist is like one of the best in the country, so it costs a lot of money. And that's why I pay, I think, like £22 a month to have the cleaning and the checking. But if I need any other work, then it's going to cost a lot of money. So I went to see my dentist. I wasn't looking forward to it. So I finished work. at 1:30. And I went ahead and made a video. I think it was about my mom. And then I went ahead and started the process of uploading that video, because these videos that I'm making here are made on my phone. I do it on my phone. And so I had to walk about 15-20 minutes to a bus stop. And then this bus stop, obviously I don't want to say too much about where the bus stop is, because I don't want people to know where I live, just in case there's some nasty people out there. And then so I went to the bus stop, and then I took the bus, and then I missed my bus stop, so I had to get off at the next bus stop and walk all the way up. So my dentist, it's not actually in the town. It's outside of the town in another place. But since it's such a good dentist, I go there. And so I went there and I was waiting for my appointment. And then I normally get to the dentist early because I have to take the bus. So I don't know how long it's going to take the bus to get there. So I get there early. And then so I'm waiting. And then they called me in to see the dentist. And I said, I haven't had my cleaning yet, because that's normally what they do. They normally clean your teeth, and then after they clean your teeth, they take you in to see the dentist. But in this time around, they said, that's okay, it doesn't need to be cleaned. And then I explained to him that, the dentist, I explained to him that I'm on aromatase inhibitors, which has given me osteopenia. And I said, I don't know if it's going to affect my dental work or not. And he said that it will affect my bone growth around, I think he said around the gums. And he said it will affect the bone growth around my implants. So he said that they were going to have to check my implants. So if I lose an implant, I don't know what's going to happen. I don't know if I'm going to just have to try to get dentures or what, because I don't think I'll be able to get another implant, because number one, I'm diabetic, that causes problems, and I've got serious diabetes now. And then number two, this aromatase inhibitor called anastrozole that I have to take. And he also said that the drugs that I take make my mouth really dry, which I probably figured that out because I'm drinking water all the time. Like now, I'm always having to have a little sip of something because I suppose that my mouth is dry, and then so in order for me to compensate for that, I just have a sip of water. So he said that because my mouth is always dry, he said that's going to affect my dentistry as well. So my ill health, having diabetes and having breast cancer that's being treated with anastrozole, it means it's detrimental for my teeth. But he told me that I've got some lesions on my teeth and I just need to put toothpaste on them. But I don't like toothpaste that much. That's another problem. I don't use a lot of toothpaste because I don't like toothpaste that much. And then so when I went, so at some point where those lesions are, they're going to get bigger. So I'm not looking forward to that. And then I went to see the hygienist after I saw the dentist, and I just explained to her that about the radiotherapy treatment, because she wanted to know how I was doing. And I said, I did have some problems after I had radiotherapy, but they just said that my problems are the result of radiotherapy. And they said that my left breast is never going to be the same as the right breast after having radiotherapy. And then so she did this hygienic work on the few teeth that I've got left. And she just said, well, keep on doing what you're doing, which I do my best. I brush my teeth twice a day. I floss them, and I have interdental sticks. And then so then I left. Then I had to walk back to the bus stop. It's maybe a mile. I'm not sure exactly how far it is. Could be half a mile, but for me, it's a long walk. And then I walked back to the bus stop, and then I had to wait 10 minutes for the bus to come. And then the bus comes. Bus takes me back into town because I live in the center of town. Not quite the center, on the east side of town, but sort of close to the center. And that was my dental trip. I've got another appointment in 6 months because I pay to get an appointment, a teeth cleaning, and a hygienist visit twice a year. I would like to be able to pay for my boyfriend to go to the dentist, but I don't have the money for him to go to the dentist. So he needs dental treatment, but he has a tooth that needs to be extracted. But I think he's not going to get it extracted unless he gets an abscess. I think he's going to leave that tooth in there, even though it's all black and rotten and everything like that. But I think he's going to wait until he gets an abscess. And then when he gets an abscess, I think he'll have to have the tooth extracted. And then my sick friend, I think he doesn't see a dentist very often either. And that's the problem. That is the problem that you get with poor people. Poor people, they either don't have the money to see the dentist, or they feel that they don't have the money to see the dentist. But the situation that I myself got into is my teeth were ruined by another dentist. And then so I started seeing this dentist, and I was seeing the dentist when I had a job. And I guess he saved my teeth as much as he probably could have. But at some point, they're going to go to, I guess he's like, keep trying to keep my teeth as long as I can keep my teeth. But I started seeing this dentist when I worked at Foster Wheeler, and then I just kept seeing them. And I'm going to continue seeing this dentist as long as I can until I don't have any money left. And then I don't know what's going to happen after that. So that's it for my teeth. I did say in previous videos that I would update you about my dental visit. So I did see the dentist, and my teeth are being affected because of the diabetes that I have and the hormonal medication that I have to have for the breast cancer. I don't consider that I'm cured from breast cancer, because if I was cured, I wouldn't have to take hormonal therapy, but I do have to take hormonal therapy. So I don't consider that I'm cured. And then basically I also want to update you on the status of my mother. So rather than make another video, I'll just update you on the status of my mother as well. So basically, she's in this rehab center. I'm not going to say the name of the rehab center to protect her privacy. But from what I understand, she's going to be in this rehab center for a couple of weeks. And then she's going to go home. And then when she goes home, I guess nurses are going to be going to see her to help her. Well, my mom, although she didn't want children, which is why she drove me away, she really did. I mean, maybe one day I'll make a video about some of the things that she did to me, but she really did drive me away. And because she didn't want children, but she's got her friends, and she likes to be pampered and babied and everything else. And so these friends give her lots of attention, which is what she likes. And so these friends are going to the hospital or going to the rehab center now to visit her and keep her company and help her with her rehabilitation. And so this one friend, who's just a couple of years younger than my sister and I, she put on this text message that she sends out, just asking people to pray, because apparently my mom doesn't sleep very well, which I already knew that. I already knew that my mom doesn't sleep well. That was one of her complaints when we were children growing up, that she didn't sleep very well. But she's not getting a lot of sleep because she's sleeping in this rehab center. But apparently in the rehab center, they have another bed in her room. And so friends and family can go stay the night at this rehab center and help her. And so my mom's friend, she owns her own IT business. And what she does is she goes into businesses and homes, and she sets up IT systems and things like that. And then so she was supposed to be working today, but she couldn't work today because my mom wanted her there, And then so apparently, because my mom didn't get a lot of sleep last night, she was tired, and she didn't want to do her rehab because she was tired. And then her friend says, well, that's not like Kathy. Well, I don't know what my mom is like. My mom didn't want me. I wasn't friends with my mom. I was a burden. So I don't know what my mom is like. So her friends know her a lot more than I do. But they just said that she doesn't want to do her rehab. She says she's too tired to do her rehab. And so her friend is asking people to pray for her. So I am going to put a prayer request on Facebook for this church I go to and ask people to pray for my mom, that she can get a good night's sleep and she feels well enough to do her or therapy. And so I think that's about it. I think I've covered everything that I wanted to cover in this video because I've got some issues that I want to discuss tomorrow morning in my video tomorrow morning. And so I wanted to get this video out of the way so tomorrow morning I can get up and I can talk about something else. Got a lot of things that I would like to talk about. So thank you so much for watching my video. So I talked about my dental visit, which is what I said I would be talking about for weeks or months. And then I've talked about my mother staying in rehab. And so I've talked about those two things. Tomorrow morning, I've got another video. So I hope you like this video. If you like my video, please like and subscribe. I'm going to be probably try to make another video tomorrow about another topic. So thank you so much for watching my video. Thank you so much for taking an interest in my life, as pathetic as it is. So I'll be communicating with you tomorrow morning, hopefully, because I've got another topic I would like to discuss.